All right, this is Dr. Donadio. We are in the hospital right now, and right now we're in the training environment, so I'm able to video this without compromising HIPAA. So I have one of my students logged in because your login is going to be, what you're going to see is slightly different than what the teachers see. So that we're going as if you've already logged into the computer and you're starting at the point where we're in care view. So, but we're, as I said, we're in the training environment. So she's going to go to care glance and start. This is pre-planning as if you're coming in the night before. So again, we're in the test environment. You see test. And she's going to act as if she's taking care of test Jeffrey Williams patient. So we're going to go from here.
Okay, so I've clicked on his name, and then if you go over to where it says RX, and you just hit right there, it will pull up the list with all of the medications, and it'll tell you the dose and the time that they're due. So this is all your medications. This is what's scheduled. And then if you hit PRN, this will tell you your PRN medications as well. Okay.
All right.
And then if you hit this red X, that'll take you out of that. Red X again, and then the big X. Okay. Okay, so from here, if you go up and see this face, it says patient profile, and it's just black and white. Click on that. And then if you hit overview, this is going to pull up his orders that are non-medication. So you'll see the diet, he's a full code, any other type of orders that he has. Okay, and then if you scroll down, this is where you're going to get your labs. So you'll see that they had a BMP. You can click right here, and this will give you the results.
So where did you click?
Okay, right here on this little piece of paper, right by the name. Click on that.
And that gives you your lab results for your
There's your
paperwork the
results.
night before.
Okay, and then you scroll down there, and then also it'll tell you the collection time, so it'll have the date. So whatever day you're looking for, just look right there, and then you'll scroll, and this will also give you the diagnostics as well. So we see that we had a chest x-ray.
And now take a look at let's look at the results of that.
Okay.
From the results, you can see your findings. And that's the information that you're going to need for your night before information for pre-conference the next morning. Remember, this is all about pre-planning, where we're doing pre-planning right now.
Okay. You can hit the X, and then this will give you, just keep on scrolling down. Over on this side, you'll see their code status. So he's a full code. If you hover over this, it'll give you the admit diagnosis. It'll also tell you the weight, the day that they were admitted, and the attending physician.
Okay.
Okay.
Thank you.
All right, and then if we go to flow sheets, and if you hit nursing.
Okay, go back and do that again.
Okay, so but
From
first
overview.
we were in overview. Now we go to flow sheets. Hit that. And then hit nursing. And scroll down, and this will give you height and weight, blood pressure, their O2, and then if you hit this right here, that's going to tell you.
Now, what did you just click on?
Click this little.
Next to O2 set?
Yes.
Okay.
Click that, and then that's going to tell you if they were on room air, or the most recent one, they were on a nasal cannula at 1.5 liters.
Excellent.
So then you can just X out of that. And this will also give you where their IV is.
Okay. That's
So
an
if you
IV
just-
management.
Yes, you just hover over that, and that'll give you the information with that. Okay. And then this is just more of just nursing information. So you can scroll through that.
Excellent.
Okay, so this part will not show you exactly, but if you go to medical record with this drop down,
Okay.
hit that, and then that's going to bring up your EKG.
Now, that's not working in the training environment because there isn't one. So it's just not letting us do it from the training environment.
So you just hit drop down, medical record, and that'll bring up the EKG with the explanation on it as well.
Excellent. Thank you.
Okay, and then if you hit this X right here, close out of that, that brings you back to the complete patient list. make sure you're still on the right patient. And if you go up to this X, that'll bring you the flow sheet.
Okay.
Click on that.
So we're on the X, we're on the flow sheet now.
Yes. And this is where you'll get your most recent vital signs. So under vitals, you'll hit this plus mark. That drops down, and you can see the date and the time, and then the vital signs.
Excellent. And this, again, we're talking about pre-planning. This is the night before that we're discussing here.
Yes. And then you can also see the I's and O's, so you can see their urine output, if they have a Foley, so that's been documented under there, and if they've had a bowel movement.
It's going to be further down, I think.
Yeah.
Remember, there's
Looks like
always
it's
look
not
for
that
scroll bars, because sometimes scroll bars will hide things and hide information that you need. So look for those scroll bars.
Yep, you just scroll back and forth. So that's where you get your intake and output.
And go ahead and scroll down further on that bar on the right. And you have more information down there. So look for those scroll bars.
Then you just hit the close button, and that'll take you out of that.
Okay.
And that.
Is there anything else that they need for pre-planning? I'm going to hit the pause button.
Okay.
Okay, so what about finding the doctor's documentation like progress notes? Where do we find that?
Okay, so make sure you're still selected with the right patient. Go back to that white and black patient profile icon.
Looks like Fan of the Opera.
Yep. Click on that. And then you'll be back over here. Go back to this drop down. Hit documentation.
Okay, we're in documentation.
And this will bring up all the progress notes from the hospitalist or anyone who has seen
And
the
what
patient.
kind of information do we get from a progress note?
Let's see.
Oh, I see a history and
on-
physical too.
Mm-hmm. Click on it.
Okay, so progress notes gives you interview history, chief complaint, present illness. All right. And what else was in there besides the progress note? The first one?
Hit that red
Close
X.
that one out.
And
And
we can
history
do-
and physical. Gives you the history and physical information for the patient. And that might be useful when you're doing your pre-planning as well, when you're telling the patient's story the next day to your professor. Is there anything else?
I think that is.
And that should be everything that you need to take care of pre-planning the night before.